need there, our program is 100% online. And so sometimes our students had trouble securing an appropriate APE site. And so speaking with our school chair and the program directors, this idea came about, and we talked about what would it look like if we put this in practice. So this is how my APE experience came about. So the School of Population Health, Nutrition, and Wellness started in 2013. It's a relatively new school. The online MPH program started around that time, and at the time that it began, it was the first online MPH program in nutrition and wellness in the US. I think many of you are already familiar with Andrews University, so I don't think I'll go too much into the background of the university. But very much like Loma Linda, it is Adventist. And of course, our specific program was established in response to a growing need of qualified public health professionals. So my project is called I Heard Podcast. And how this podcast came to be named was I also work as a health educator. And during the COVID pandemic, I heard a lot of health misinformation. And often they would begin with, Krystal, I heard. And I thought, that would be a really great name for a podcast. And so that just I just kept that in the back of my mind. So the I Heard podcast aligns very closely with Andrews's mission in that we are both committed to improving public health through innovative education and service. We're also committed to promoting health literacy and evidence-based communication, and of course, preparing future public health leaders. So a little description of the project. As I mentioned, it is a podcast, not anything really revolutionary, but for what we wanted to do as a school, it was definitely something that was new to us. And basically, the podcast, its main goal was to address health misinformation by blending storytelling with evidence-based insights. And so this podcast mission was to enhance health literacy through preventive care and practical applications. So the project, and I'll talk about this a little bit later on, it took place over a series of 5 months. This is the initial implementation of the project. It's still ongoing, but the initial implementation is what I'll be talking about today. So the project involved planning where we went to the literature and we identified popular prevalent health myths. Excuse me. Then we established our team roles. Before that, I should say, I had recruited MPH students who were registered for their APE. So because this project relies heavily on health research, the students needed to have completed courses that they received competencies related to health research to take part in this project. So we established our team roles, the structure of the podcast, as well as the timeline, which I mentioned was over 5 months. So that was from August 2024 until December 2024. We finalized our topics and made sure that they were relevant and impactful. As you all know, there is a wealth of health misinformation, but we wanted to make sure that the topics were relevant to our audience, which were university students, as well as some older adults who were very new to things related to nutrition and wellness. Then we went into our research and script writing for the episodes, and we recruited some health experts. We managed to recruit 2 experts, and we recorded an episode with one, and then we have another waiting for our next season. So we're very excited for that. Then we refined the scripts based on the expert feedback as well as insights from our audience. And then we edited, produced episodes, and then launched those episodes. And then following the episodes, we did some evaluation to gauge the impact. So the project had 5 objectives. First objective was to create evidence-based, high-quality podcast episodes. The next was to boost our reach with strategic marketing plans. And the third was to ensure accuracy through expert collaborations. The fourth was to mentor students to build health program planning, which is another course that they had to have completed before partaking in this project. And of course, increase their health communication skills. And of course, the overall objective of this podcast was to foster health literacy skills among our listeners. As we progress through this presentation, I want you to take note of the graphics on screen because those were used in the promotion of the podcast and those were developed by our students. We're very proud of the work that they did there. So here you can see this is a timeline, very straightforward of the project. Took place over 5 months. Planning, research, and development was the bulk of the podcast that was ongoing. So we were always researching, always fleshing out episodes. And we didn't wait until an episode was published before we went on to the next one. We're constantly doing this. So here on the left, you can see some of the promotional material for the podcast by our team. So we had pretty good results for the initial implementation of the podcast. On my end, I did process evaluation with my students. So we did weekly check-ins where, I just wanted to know what they were feeling about their contributions to the podcast. Before they started the podcast, they had to fill out some forms listing any skills that they wanted to improve or that they wanted to develop by taking part in the podcast. And so we would go over those forms and to see where they were in terms of what they had put down there. And of course, there were other mentorship duties that I had to do that were part of the process evaluation. And at the end of the podcast, I did overall evaluations of all the students involved that were required by the university and the program. As it pertains to the podcast, we did outcome evaluations, which included listener feedback. We got positive reviews on, the format of the podcast. Our listeners really liked the storytelling format to that. And so I think that was a really good approach that we took. We also looked at episode downloads. So for this initial implementation, we focused mainly on nutrition and wellness. So it makes sense that episodes that dealt with diet myths and exercise had the highest engagement. And we also found that episodes under 20 minutes performed better. We also did a number of surveys during the production of the podcast, and early post-listening surveys gave us really good results, showed that the audience, they were receptive, as I said, to the storytelling myth debunking format of the podcast. We also looked at social media analytics. We were mainly focused on 2 social media sites, so Instagram and Facebook. Most of our listeners were on Instagram, and I think that just speaks to our audience age. And it showed that we really had a steady audience interaction growth. And we saw that through the likes and shares and the impressions that we got on the different episodes or the different ways that we engage with the audience. So what are our next steps? So after we completed the podcast, we realized that I think, which is pretty common, we really needed to fortify our evaluation approaches. So we've been analyzing the surveys that we did do. A big lapse in our judgment and limitation was that we didn't focus very much on pre-listening surveys. And so we have been developing surveys to gauge pre-listening audience knowledge on different topics their health literacy skills, and that will help us, or that will help inform future episodes. We're also planning on refining episode topics for the next season. As I mentioned, and this goes into number three, expanding the scope of the myths that we address. As I mentioned, we mostly focused on nutrition and wellness, but in the next season, we'll be expanding to other health related myths. So we're pretty excited to kind of spread our wings there. We also want to work on our promotional strategies for growth. We did a lot with social media, but we kind of neglected. We did some, but we didn't do enough in promoting to the students within the public health programs at Andrews University. And I think because we were very focused on our online audience, so that's another area that we're going to be focusing our efforts. And then because we have the positive results of the initial implementation of the project, we're hoping to secure funding from the university to kind of help us put some of that towards marketing, and also maybe securing more experts in future episodes. All right. And so this is, basically a very brief overview of what I did on my project. And if you have any questions, I'm open to answering them. Thank you.
Thank you very much. This is really exciting. It's something that is going to continue. It's not common to have here projects that they will continue and amplifying. So good job, good job, good job. So open for questions.
Yeah, excellent project, Krystal. I found it a very fascinating job. Could you go to the slide where you talk about the SPH Nutrition and Wellness School? I think it's before your project description slide.
You have to share your screen again.
Are you able to see? There we go.
Somewhere you said it was, the third bullet, it says, and included the first online MPH program in nutrition. It's starting in 2013. I thought the School of Public Health here at Loma Linda had a nutrition program that preceded 2013. So I'm curious about the word first online.
It's not online, Dr. Beason.
Okay, so the first part is the online part, not the nutrition part.
Yeah.
Yes. First online, yes. Sorry.
Okay, I missed out on the online part of that. So Loma Linda has a nutrition program, but it's not online.
Yes.
Okay, thank you. Good job.
And the guy that started was Dr. Alfredo Mejia, no? Yeah,
Dr. Mejia.
From Loma Linda. So
yes.
We help
I
you
think
guys.
all our professors are from Loma Linda. Yes.
We are a family, a big family.
Yes, that's true. I think Kevin had a question.
Do you know how many online nutrition programs are now? Since yours was the first, how many now have an online nutrition?
I don't know. That is something I will look up later. That is a good question. I don't know. I know a lot more than there were in 2013, that's for sure.
And how many students you have? Do you have an idea?
So we hover around for this school year, about 40 students.
Okay.
It's a small program. And we just started our first on-campus program, MPH program. So, we're kind of doing things backwards. We did with the online and then we're going on campus, but yeah.
Because we figured out that on campus, when we did both, we didn't have students enough on campus. So there was a time that we have 10 students online and one on campus. Can you imagine? Go to a classroom, one student sitting there and 10 on the TV. So
that's what we're doing now with the and with the changes in the laws applying to international students, we're trying to figure out how we're going to navigate that. But yeah, interesting challenges ahead.
It looks like Kevin has a question. Go ahead.
Yes, thank you. I do have a question. I am actually really excited about this opportunity because I was having the same idea of doing something, but with the deaf community. How are you able to convince the powers that be with your proposal that you would be able to continue this self-editing, self-adjusting? How are you able to convince them to support and kind of sign off on your project, whether it be the administration or considering the costs, because that can be quite a costly project as well?
That's a great question, Kevin. And the short answer is that I've got connections. The long answer is that this is something that is very, very much needed for our program. As I said, before last year, we were completely, fully 100% online. And because our students, the APE is foundational to public health programs, they needed sites that were approved by CEF. So speaking to our contact at CEF, speaking with the school chair and the program directors, I kind of put this idea to them because one, it would provide an in-house opportunity for our students. We're also an organization, and CEF agreed that, there would be no conflicts of interest there if we were to provide or serve as an APE site ourselves. And also, the school allots funds for students involved in research and different projects. And because this is a great need and it's addressing a need within the school, and we also have evidence of the podcast making an impact. And also, this podcast can go so many different ways. We can work across disciplines within the university. That's what's so great about this podcast. When I was speaking with one of our experts who is another Andrew's faculty, they were in the theology department. They were interested in working with us. So I think we're really positioned to do something really impactful with this podcast. And my initial conversations with the school chair and the program directors were hopeful in that, yes, we can get this funded. We can expand the scope of this podcast, but we're still in talks about exactly how we're going to do that. But I would say evaluations are key in convincing people. If you can show them that you are achieving your goals and it's making an impact, I think that would be a great way to convince them. I hope that answered your question, Kevin.
I was looking at this slide and I was thinking 150 years, your school is much older than us.
Yeah, we just celebrated our anniversary. Yes. Yeah.
That's great. That's great. Okay, Krystal, if no other questions, so we thank you for that. It was excellent. We really appreciate that.
Thank you. And if you're interested in coming on to our podcast, we'd love to hear from you. We're always looking for experts to share their insights. So
Yeah, for sure. Yeah, I would like to cooperate, and if anybody wanna contact, well, they know you, so they have your email. Everybody
yes,
here can contact you. Well,
Yeah,
thank
excellent
you very much.
opportunity to
Sorry, Dr. Biz,
expand.
we miss your words.
Yeah, it's an excellent opportunity to expand.
yes.
For sure, for sure, for sure. Now we pass the time to Tala. So you have your time now, Tala.
All right. Let's see.
You do a brief introduction of yourself, okay?
Sure. Can you guys see my screen okay?
Yes.
Okay. So hi everyone. My name is Tala, and a little bit about me. I am a third year DrPH student in the preventive care program, and I actually just passed my dissertation defense. So now I'm almost
Congrats,
done.
congrats.
Thank you, thank you. So I'm almost done. I just need to fix up the paper and publish it, and then I'll be all done. So I'm really excited to present the implementation and evaluation of a motivational interviewing training program at City of Hope. And this was part of my DRPH practicum. So this project really focused on improving patient-provider communication and clinical outcomes through structured training in motivational interviewing for healthcare staff. So this is just a brief overview of what I'm going to cover today. So we'll begin with the public health issue that this project addressed, followed by an overview of City of Hope and the project's rationale, and then I'll walk you through the literature that guided our approach, the program's design, and the evaluation methods we use. And after presenting the results, I'll discuss key insights and alignment with our DRPH competencies, lessons learned, and future recommendations. So first, I serve as the project lead, designing and facilitating the training series as part of my DRPH practicum at Loma Linda University. So this was a hands-on opportunity to integrate research, leadership, and health education in a real-world setting. So at City of Hope, this work wouldn't have been done, would haven't been possible without the support of the clinical education department there, who coordinated logistics, outreach, and staff engagement. And we also had strong champions within the oncology nursing leadership and physician researchers who help promote the program and model the skills. And just want to say a huge thank you to the support staff, so the administrative, scheduling, IT, and facilities team who ensured each session ran smoothly. And this project truly reflects a multidisciplinary collaboration, and I'm deeply grateful for every person who helped bring it to life. And before I go into the reason why I chose City of Hope is my first job out once I graduated undergrad was at City of Hope. So I've always had a really good relationship with the organization, and any opportunity I can to give back, I always try to do that. So chronic diseases like cancer, diabetes, and cardiovascular conditions account for 71% of all global deaths. These illnesses demand not just treatment, but long-term behavioral management. Research shows that poor communication between providers and patients is linked to non-adherence, dissatisfaction, and worse health outcomes. And that's where motivational interviewing, or MI, comes in. It provides a structured way to build rapport, support autonomy, and evoke motivation for change. So City of Hope is a nationally renowned cancer research and treatment center in Duarte, California, with its longstanding commitment to compassionate, science-driven care. It was a natural fit for this initiative. The project aligns with the organization's mission to transform the future of healthcare by turning science into practical benefit, in this case through communication science. So while City of Hope excels in cutting-edge treatment, many clinicians voice challenges in navigating sensitive conversations, especially when patients are ambivalent or overwhelmed. So traditional training rarely prepares providers for this, and MI, with its emphasis on empathy and collaboration, helps clinicians support patients without pushing. And this project aimed to equip staff with these essential skills.
I'm
So
sorry,
program-
this interpreter, can you slow down a little bit? Thank you.
Oh, sure. I'm sorry.
Yeah, just speak at a normal pace and don't read. Thank you.
Okay. So our program was grounded in a strong evidence base, multiple systematic reviews and meta-analysis, including work by these authors here, demonstrate MI's effectiveness in improving health behaviors and treatment adherence. MI is not only effective, it's learnable, scalable, and sustainable in real-world clinical settings. So we designed a 5-session training series for nurses, physicians, and research staff. Each session built on the last, combining theory with practice, particularly through role plays, group feedback, and interactive exercises. The goal was not just to teach MI, but to help staff internalize it and apply it in patient care settings. And this project was a fast-paced 5-week practicum-based intervention designed to train clinical staff in motivational interviewing at City of Hope's DrPH campus. The goal was to enhance patient-provider communication, particularly around challenging topics like treatment adherence, health behavior change, and emotional readiness for care. The program was structured as a series of live interactive workshops supported by a comprehensive MI training manual, handouts, and pre- and post-evaluation tools. The training targeted nurses, research coordinators, and physicians, those with frequent and meaningful patient interactions. Each session built upon the last, reinforcing both core MI principles and practical communication strategies. On to the project goals. So our primary goal was to enhance patient-provider communication using MI. Specifically, we aim to train at least 80% of the targeted staff, improve their MI competency, and ultimately support increased patient satisfaction and adherence. These goals were carefully chosen to reflect both behavior and outcome change. So the theoretical framework, the motivational interviewing training program at City of Hope was built on the theoretical foundation established by Miller and Rolnick, who developed MI as a patient-centered directive approach to enhance intrinsic motivation for behavior change. At the core of this framework are 3 guiding principles: collaboration, evocation, and autonomy. Unlike traditional clinical conversations where the provider directs the patient, MI encourages a partnership. Providers work with patients, not on them, inviting them to explore their own values and reasons for change. To operationalize these principles, we taught staff the OARS skills, so open-ended questions, affirmations, reflective listening, and summarizing. And these are not just communication techniques, they're tools for deepening trust, uncovering ambivalence, and guiding patients toward meaningful change. We also framed the behavior change process in 4 stages. So engaging the patient, identifying a focus, evoking motivation, and planning next steps. Each workshop session emphasized 1 or more of these stages, helping staff build layered competencies over time. And this framework helped ensure the training was not only evidence-based, but also coherent, practical, and directly applicable to the complex interactions staff face daily in oncology and chronic disease care. So a little bit of the curriculum overview. So the curriculum was structured over 5 sessions. We began with foundational skills and progressively introduced more advanced techniques like evoking change talk and managing resistance. Each session included discussion, demonstration, and hands-on practice to build fluency and confidence. So the methods here, the training was held on site at City of Hope's DrPH campus and targeted a diverse group of clinical staff. We prioritized those with regular patient contact and designed the sessions to be accessible across departments. The project ran over 3 months, including planning, delivery, and evaluation. So we used both quantitative and qualitative methods. Pre and post training assessments measured knowledge gains Focus groups and surveys captured real-world applications and perceptions. Patient satisfaction surveys were included to explore how MI-trained staff impacted patient experiences. So for the results, we saw a 40% increase in MI knowledge and skills based on assessment scores. Over 80% of the target group completed the full training. Patient satisfaction scores also improved the following encounters with trained staff, evidence that the skills were not only learned but applied. Staff feedback highlighted increased confidence, better listening skills, and an improved ability to navigate difficult conversations. Many participants reported that the role plays were especially powerful for integrating what they learned and applying it in their real-world settings. So here, we're going to dive into the impact of our motivational interviewing training program. So prior to the training, participants averaged a 60% on our MI competency assessment, which evaluated their understanding and application of MI principles. Following the completion of the training series, the average score rose to 84%, marking a substantial 40% improvement. This significant increase indicates that the training effectively enhanced the participants' MI skills, equipping them with better tools to engage patients in behavior change discussions. And these results align with findings from previous studies, which demonstrate that MI training significantly improves practitioner skills and confidence in applying MI techniques. So beyond enhancing staff competency, we also assess the training's impact on patient satisfaction. Patients rated their satisfaction with provider interactions on a 5-point scale. Before the training, the average satisfaction score was 3.8. After the training, this average increased to 4.5, reflecting a 0.7-point improvement. Patients reported feeling more heard, respected, and involved in their care decisions, which are core outcomes of effective MI practice. This improvement is consistent with literature indicating that MI-trained providers foster better patient engagement and satisfaction. For instance, a study by Lundell found that MI interventions in healthcare settings led to enhanced patient satisfaction and treatment adherence. So this project yielded several deliverables, a 5-session MI training curriculum, pre and post assessment tools, a feedback database, and templates that could be used in future trainings. We also developed a facilitator guide to help sustain the program long term. So these are the training materials. So to support learning and reinforce practical application, each session of the training was accompanied by a tailored handout. These materials served as quick reference guides for staff both during and after the training. So we're going to start with handout 1. It introduced motivational interviewing at a foundational level. It outlined the spirit of MI, which is empathy, collaboration, and respect for patient autonomy, and described how MI differs from traditional directive approaches to patient counseling. So handout 2, titled Engaging Patients, focused on the initial stage of an MI conversation. This handout offered techniques for building rapport, demonstrating empathy, and establishing a therapeutic alliance. It emphasized the importance of genuine connection as the basis for any meaningful change dialogue. Handout 3 was all about eliciting change talk. This resource helped participants recognize and respond to different types of change talk: desire, ability, reasons, need, and commitment. We included example phrases, prompts, and strategies for drawing out motivation from the patient. Handout 4, which is managing resistance, addressed one of the most common challenges in patient communication. This handout provided techniques like rolling with resistance, double-sided reflections, and reframing, equipping staff with tools to de-escalate tension and keep the conversation moving forward. Finally, handout 5 offered a structured approach to integrating MI into clinical encounters. It guided staff through the full arc of an MI-informed conversation, from openers and agenda setting to evoking goals and planning next steps. This handout was particularly useful for helping staff apply MI in time-limited real-world settings. Together, these 5 handouts were intentionally designed to be both educational and practical, supporting staff at every age of the MI learning curve and ensuring that new skills translated directly into patient care. So in addition to the individual handouts, we developed and distributed a comprehensive motivational interviewing training manual for all workshop participants. So this manual was designed to serve as both a learning companion during the training and a long-term reference tool for clinical use. The manual closely mirrors the workshop curriculum, with each section aligned to a specific session. It begins with a clear explanation of the spirit and principles of the motivational interviewing and progresses through the OR skills, techniques for eliciting change talk, and strategies for managing resistance. Each section includes clear definitions of core MI concepts, sample dialogues, and real-world scripts, practice exercises for reflection and skill reinforcement, visual tools like conversation maps and decision trees. This structure allowed participants to revisit what they learned in the workshops at their own pace and to continue developing their MI skills beyond the formal training period. Importantly, the manual also functions as an onboarding tool. So as City of Hope brings in new clinical staff, this manual can support consistent training and sustain a culture of patient-centered communication across departments. So by combining evidence-based content with practical guidance, this manual ensures that motivational interviewing isn't just a one-time training, it becomes part of the organizational fabric of care. So this is just the other pages in the workbook. For the sake of space, I didn't include the last couple of pages, which are like references. There's like a notes page so participants could keep their notes and like contact information and things like that. So the results support what the literature tells us. MI is effective and trainable. Even within a short time frame, staff improve their communication approach and patients notice the difference. These findings support scaling the program within and beyond City of Hope. So this project reinforced several DrPH competencies. I worked across disciplines, assessed my leadership capacity, and integrated cultural awareness into program design. This experience was both a capstone project and a transformative learning experience in systems-focused public health practice. So like all projects, ours had limitations. The follow-up period was brief, limiting our ability to assess long-term behavior change. Some staff were initially skeptical of the training, and these challenges taught me valuable lessons about implementation science and engagement. So going forward, I recommend refresher trainings every 6 to 12 months, expanded training for more staff, and further evaluation of long-term patient outcomes. Publishing this model could help other institutions replicate or adapt our successes. And this project deepened my understanding of implementation leadership and education in healthcare. I gained new skills in facilitation, cultural adaptation, and systems thinking. And most importantly, I saw how communication can transform care, both for patients and providers. So I'll close with this idea. People don't change because we tell them to. They change when they feel heard. And this is the heart of motivational interviewing. So thank you for your time, and I'm happy to take any questions now.
Thank you, Tala. Thank you very much.
I'm going to stop sharing because if I share, I can't see you for some reason.
So this is very exciting. It shows that, it shows another way of preventive care activity. So training the trainers. We always are concerned about dealing directly with patients and clients, and Tala is showing that, hey, you can do that indirectly. You can train trainers and then do a good job and help them, enable them to do their job adequately. And we are happy. Thank you for sharing that. Thank you for doing that. My first question is that why City of Hope?
So like I said, I have a connection there just because of my work experience there. And I know people who have actually gotten care at City of Hope, and that was kind of the reason why I wanted to work there to begin with. And just like from what I noticed and what I observed during my tenure there, I felt like there was just something that could be improved with patient care. And I know that, especially when you're working with patients that have cancer and have these long-term, treatment plans and things like that, it's really important to, have that conversation and kind of, as a physician and as a healthcare provider, make them feel heard, especially with, all the things that they have going on and trying to, drive the conversation and instead of like the physician dictate like, okay, you need to do this, you need to do that, encourage that conversation with patients.
Good. Yeah, the question for me is why not Loma Linda? I think we need this
I
more
would love
than
to do it. I would love to do it, Loma Linda. Um, I would love to continue this even where I work now. I think it would be really helpful. I've already spoken to the training and education department here. And the reason why I decided to kind of do motivational interviewing is because a few months ago, my current job tried to do a motivational interviewing workshop, and it wasn't really effective. And I didn't really like the way that it was being taught. And I was like, okay, if I'm not liking this, I'm sure other people in the room aren't liking this. And I was like, I want to work on a way to develop something that would be beneficial to, different kinds of jobs, different kinds of experiences. There's people that work directly with patients, there's people that work indirectly with patients, and just kind of facilitating that divide and getting people to understand what MI really is was felt really important. But yeah, I would love to like do it at Loma Linda. Definitely would have been easier for me to do it at Loma Linda because I was driving to City Hope once a week for 5 weeks to do this. So Loma Linda would have definitely been a closer drive.
Kevin, please.
Yes, thank you. This is very, very exciting. And I would love for staffs in all the different clinics to do this training. I think it's very, very exciting. So my question is, have you thought of hiring a CHW community health worker? Because I think that would definitely be very beneficial for this training, if that's something that you've considered.
Oh yeah, absolutely.
It perfectly ties into their jobs and their duties, including in the program.
Yeah, yeah, definitely, absolutely. I love community health workers. At my current job, I'm constantly working with community health workers, community health educators, and I think it would be a great idea to have someone with that kind of background and experience also help facilitate these sessions. And hopefully, I'm able to continue with these training sessions and do like the follow up and things like that. So I think it would be a really, really good idea to incorporate someone like that too.
Excellent, excellent. By the way, there was a Dr. Michael Arlowski that was our trainer for health coach, the one that initiated the health coach in Loma Linda. He had a plan to have health coaching community helpers. I don't know where they are with that program, but train people at the community level, not at the
Yes.
academic level, not at the clinical level, that they could do this because they already empathize with their clients and with their community. So
Mhm.
they have one advantage at least on that. But I don't know where the program is in regarding that.
No, I think that would be a great thing to add, definitely. Um, and me working closely with community health workers and community health educators, I see um, even when I, just nosy on by, I'm seeing like, oh, what are you guys working on? And I see like the sessions that they're working on and like the way that they have to cater to like different groups. So like whether it's middle schoolers, high schoolers, if it's physicians, if it's different populations, disadvantaged populations. So yeah, I definitely think their job is really, really important, and doing like creating these like sessions and helping the community get access to this sort of education.
Great. I'm not sure if we have any other question, but we appreciate that. And this is the last session of the preventive care grand rounds this quarter. We appreciate that we finish it with a high level with the two presenters today that brought some important issues and innovative issues that that the program or the graduates in the program can get engaged in. So thank you very much, Krystal, and thank you very much, Tala, for that. Okay, if no more questions and no more talks, we will finish.
Both presentations, excellent.
Thank you all.
Everyone.
Thank you.
Hope you have a good night, and we'll see you next quarter.
Bye,
Bye-bye.
everyone.